I think growing up here, I didn't realize how underserved it was. I never really thought about it because I lived here, so I lived in it. That means we got a week off school for deer season. That's how we're all, and for me that was normal. I never thought anything of it. This is Appalachia, and if you look on the CDC website of poverty and low income, Southeast Ohio and Eastern Kentucky are the lowest in the nation for Appalachia. And what that leads to is actually very high health disparities because there's also very little access to health care.
Been doing a outreach project in Athens for quite some time with Sarah, and that's allowed us to put students there who serve the population, but they also learn about the difficulties that are associated with being in an underserved healthcare area.
So I bring usually 2 students down from Ohio State on rotation with me to the free clinics, and this is what we do. We do an immunization-free clinic, and the acute care clinic, and we do a diabetes clinic and a dermatology clinic.
When I first heard about it, this sort of cemented the idea that I wanted to come back here and work as a pharmacist because I got to see patients from this area, of course, and this is really my first chance to come back and apply what I've learned.
It's a rural area, and they had a lot of rotations to offer down here in different environments that you wouldn't necessarily see in a bigger city like Columbus, especially how you take care of people in a rural setting.
If you think about what pharmacists do well, there's essentially 3 areas that I talk about. The first is treatment of minor ailments, things that you might go to a physician's office or you might go to an emergency room. The pharmacist can help you with simple treatments with OTC products. The second area is in chronic disease state management, common disease states that you're going to be treating for a very long period of time. The relationship with your pharmacist could be the primary relationship to manage that disease state. But then there's a certain portion of the population that has very complex care. And this is the third area that pharmacy has shown itself to be very good at.
We have poor. So we have poor that were born poor and that stay poor. And then we have patients who have worked hard all their lives, good jobs, and then lost them. And then can't find new ones. So they lost their insurance, and so they're down and out.
People who don't have money, people who aren't taking care of themselves, no insurance. It's when things hit the roof, basically, and how you can help them.
Follow-up with care is very poor for a lot of these patients because they only come to you in the most urgent of need.
I was looking at the number of primary care providers to the number of patients, and in Meigs County listed 1 primary care provider to about 10,000 patients in the area.
I love it. I love this program. It helps people. We're compassionate, we're caring. We help people that otherwise might not get medical care without us.
When a pharmacist is added into the primary care of that patient, you generally have a better improvement in the quality of life and a decrease in the overall cost of health care with that patient.
She is exciting to work with. Her passion really helps fire you up and gets you excited to come down and be part of the service that is down here so that hopefully we can turn this tide.
You don't have to spend much time with her to know that she's a person with a lot of energy and a lot of enthusiasm for what she does. And the first day that I was with her, she had so many other interactions. There would be so many people that would want to stop and talk to her. So
She just has that positive attitude. She has that happiness that they like. She's not judgmental, and these patients need that because they're used to being judged. She's probably my best friend. She's there for me all the time.
One of the big things I want here is a free drug program, free medication. So this area, people can't afford their drugs, and I want them to be able to get access to free medications. Another thing is collaborative practices. I would love to have a pharmacist or a pharmacy student in all of the clinics in this town. And I think it's a possibility. Rural care, I'd love to expand the free clinic.
It's a sense of responsibility about what does a state-supported College of Pharmacy have to do for the state. We hope and we feel that the program that we're offering in Athens does that for the community.
I feel like there's something here that's worth working for, worth helping. People here are genuine, and the people here are really friendly, and they are the people that helped raise me and rear me, and I wanted to ultimately give back.